I'm here with the man, Dr. Wassim, and you have an alternative for what I call crepey thin skinned hands.
Yes, absolutely. Tendons start to show, veins start to show, and the skin becomes a bit thinner. So we have a product called Ellansé, and Ellansé works in two ways. It volumizes it initially, but then the volumizing capability goes down, and it releases these microspheres of a compound that then stimulate type 1 collagen.
So the first thing I have to do is to numb my hands?
Yes.
So we're going to do that first. Let's do it.
Let's do that.
Little numbing. I am actually, my pain threshold is incredibly high, but you like to just numb your patients.
Absolutely.
So we've got Dr. Wassim, and then because I'm really tired, Amy, this is really feeling pampered, is works at Trinny, and we're gonna do a Dermalux LED because it would just take away my tiredness. I feel much better actually not seeing it working, because in case it's a bit painful. Dr. Wassim, what's the youngest age hands you've done?
Probably 40s.
And what do you think are the things that most concern women about their hands?
I think crepiness of the skin. I think when tendons become more visible, sort of skeletal hands, veins showing. And so this treatment is really to mask those things.
So what's the difference then between doing a 1-year treatment, a 2-year treatment, 3-year treatment, and a 4-year treatment?
So the treatments are absolutely identical. It's just that, and the formulation of the product is exactly the same. It's just that the chain length of the product is a little bit longer, so it takes a bit longer for it to break down. The volumizing it's not dramatic, but it will be noticeable, and that will subside. That should be nice and numb for you now.
I can't tell until you stick the needle in.
Okay. It's a round-tipped needle, so it's rounder so that it can make its way through the tissue without sort of creating any damage to nerves, arteries, vessels. It's like a needle, but it's round-tipped, which makes you question where the product comes out of. It's completely round at the tip and it comes out. So if you see this needle, it's round, and then the product is going to come out that way. See where the black mark is there? The product will come out that way. So it doesn't come out the tip like a traditional needle, it comes out the side.
Okay, got it. And is that so the product can be distributed as you pull it back?
Absolutely. I'm going to basically do tiny little threads of the product in the skin. Any pain?
No, it's all right. It's just a slight
stinging.
little stinging.
So before you came, one I made earlier, I put a tiny bit of anaesthetic into the product as well. So what we do now,
and is that so that it just numbs
makes it a bit,
more?
yeah, a bit more painless. You can see tiny piercing with the needle, and then tiny, tiny threads of the product. And we're going underneath the vessels because we can then massage the product. We massage away from the fingertips towards the wrist.
As I'm lying here, I'm thinking, do I want this alien product inside my body, and what happens to it?
It's completely biodegradable. It will be broken down by the body into carbon dioxide and water.
And does that mean that if they want to make it last longer in the body, what are they doing? When you say they lengthen the chain?
The compound is just a longer chain of the compound. Think of it as a long chain, like a necklace, different lengths, and if you put them all in Coca-Cola, for example, and they're going to dissolve, the long one's going to take longer to dissolve. Now, I've done 3 entry points. Ideally, I would have done 1, but...
Why did you do 3?
Because the cannula, I probably would want a longer cannula so it can reach a little bit further. So with a longer cannula, we could probably use 1 entry point because we'd have reached all these areas. And you can see it's starting to volumize ever so slightly. I'll do some massaging at the end.
I mean, I feel I've turned into the Michelin Man.
And with the profiler, remember, we kind of leave the profiler to do its thing. We don't really touch the bumps. Whereas here, we're gonna massage it a little bit afterwards. Okay. So I'm just gonna give that a few seconds. Okay, so I'm just gonna do some massaging now.
Yeah.
So I'm going to massage the product now, and I'm going to push it towards the wrist. And you can see, even though ideally I would have liked to have 1 entry point, it doesn't really, they're almost not noticeable.
That's really good. So this hand's done. This hand's not done.
Hand number 2. Just look at the difference to begin with as well. I mean, look already. Crepiness there, the sort of the troughs of my hands compared to the kind of roundness, evenness of that one. So you're saying I would do this and then I wouldn't have to have it done for a year?
Correct.
Okay, that's good to know.
Correct. And it's quite a safe product, so the actual risk of side effects is low.
So this is also used in the face?
Yes, absolutely.
As a filler?
Yeah, as a collagen stimulant and a filler, yes. So there's the volumizing ability first, but it's the fact that it stimulates type 1 collagen that makes
So
it
do you still
popular.
use it in the face?
I do, yes.
You do. I've always been very low hand maintenance.
That's pain. Right there.
Mm-hmm.
It's even there. Just massage it. It's very forgiving. Just gonna go very gently here. Let me know if it's uncomfortable. Just turn the head. Almost done. I think the hands are often neglected when it comes to things like SPF. So when you're driving, when you're out all day. So I think the most simple thing you can do is put, a high SPF on your hands. How are we doing, Trinny? Okay?
Yeah.
Massaging always towards the wrist. There is nothing for Trinny to do home care-wise. I'm just using a post-procedure fluid which has arnica and aloe, which reduces redness.
So there's the hands. This wasn't painful at all, and then this side was a tiny bit. Will those be bruises, or will they just be marks? They'll just go.
Tiny marks, yeah.
They'll be tiny marks. They'll go. Okay.
They'll just go.
So there isn't, nobody would know how to have it done, but I'm really excited to just see it in light of day and in a day or two's time. And thanks to Amy, little Dermalux Radiant Frequency. We're at the Teresa Tommy Clinic. Dr. Wassim.
Bye-bye, thank you.
Bye! Day 2 of the hands. As you can see, they're still a little bit puffy, but definitely don't have the ridges I used to have. Still got the little marks from the injections.